Hi, I'm Dr. Greg Hall, and today we're going to talk about lowering your blood pressure. It's critically important because high blood pressure, or hypertension as it's called in the medical field, is related to our increased risk for heart attack, for stroke, for kidney failure, being on dialysis, for circulation problems, for aneurysms in the brain that rupture that kill people. Hypertension or high blood pressure is the cause behind all of these. And so now, have you seen those new monitors? You could, for $35, you go to Target or Walmart, you can buy a blood pressure monitor. One that goes on your upper arm. Don't use the wrist one. That's not quite as good, but one that does your upper arm. Measure your blood pressure at home when you're calm, when you're feeling good, and see what your blood pressure is. Because a lot of my patients, when they come to the office, they'll say, well, it's high now because I was late, or because I was late, because they almost had an accident, or they were worried, or whatever. But when you measure your blood pressure at home under the most ideal situations and it's high, that's a problem. That's going to put you at increased risk for heart attack, for stroke, kidney failure, like we've talked about already. So if you measure your blood pressure at home, you don't have to wait and just come in to see me, or go to the drugstore and measure it there. $35, you can have it, measure everyone. I measure the wife, my kids, everyone's blood pressure at home when I pull the machine out. You should be doing the same thing. So now, what readings do you want to see? In general, I want to see 120 over 70. I want to see nice 118 over 68. Those are ideal blood pressures. You could almost live forever with a blood pressure like that, right? What don't you want to see? You don't want to see anything higher than 140 over 90. That means you probably need medication. Now, if it's below that, say it's 130 over 85, you're gonna want to watch your salt, maybe see what you can do with your diet, make sure you're getting the proper nutrition. Maybe you should be exercising more, right, to bring that down, because it should be coming down lower, but you definitely don't want to see something greater than 140 over greater than 90 consistently for over time. That's not good, because that's when you end up having a heart attack or stroke after that. I've had people come in with 190 over 110. My goodness, that's an emergency. That's a problem. But people have those blood pressures. If it's high, you need to go to a doctor, have them documented, bring your machine, show them what your blood pressure is under ideal situations, and then get on medicine. Because what happens is 48-year-old, 49-year-old people are having heart attacks and dies, and everyone's wondering, what happened? What happened? And the reality is that person has had untreated high blood pressure for 15, for 20 years. A crazy fact is a third of African American men at 30 have hypertension. A third of African American men at 30 have hypertension, have high blood pressure. That's crazy. So when you're 48, you've had high blood pressure untreated for 18 years. So that's why I'm checking my son's blood pressure at the kitchen table when I check mine in the morning. So we got to find these people with the high blood pressure and get them on medicine, or get them exercising, or whatever we need to do to bring their blood pressure down, so we don't have the highest stroke rate in America. African Americans have the highest heart attack rate in African America, the highest hypertension rate in America. So we got to reverse that. Some of that is exercise, some of that's nutrition, but some of it is stubbornness, because we don't want to be on blood pressure medicine. That's crazy. You think you're healthy because you're not on blood pressure medicine. Other people are healthy because their blood pressure is normal and they're on blood pressure medicine. They're healthier. So, not being on medicine is not a measurement of health, right? Your blood pressure is a measurement of health, and a high blood pressure is not conducive. It's not sustainable, and it's preventable, right? There's medicine for it. So if you need more information, go to drgreghall.com. If you need a multivitamin, and I know you do, go to sequencemultivitamins.com and get your bottle of GNetX Sequence Multivitamins for African Americans. Address those deficiencies: potassium deficiency related to increased cardiovascular problems, magnesium deficiencies related to heart problems and diabetes. You may need those nutrients as well. So until next time, take care.
you.